Good morning, everybody. Welcome to another edition of Colorado & Company. Mark McIntosh, along with the DNC connected Denise Plant. Yay. Man, she was out hobnobbing with the stars last night.
Show us how facial cosmetic surgery has come a long way when it comes to giving you a new look.
All right, you ready?
For today, Dr. Jeffrey Raval has a new technique he's sharing with us today, one that was especially developed for nose job surgery. What this is all about later on Colorado & Company. We'll see you here soon.
Surgeons in the country, and listen to this. In 2007 and 2008, he was named one of the top facial plastic surgeons in America by the Consumer Research Council of America. Today, Dr. Raval is going to discuss a new technique that he developed for rhinoplasty or nose job surgery using a novel technique that he has developed that he has termed the Denver nose job. He's joined by one of his patients, Craig Mueller. Good to see both of you. Welcome to the show.
Thank you.
Back.
It's good to be back.
You're looking dapper there, man.
Oh, thank you. Thank you.
And tell us about this. What's going on?
Well, you know, I guess before we even talk about what this technique is, we need to really talk about why it came to be. And, you know, as they say, the necessity is the mother of invention. So whenever we do nose surgeries, there are always a lot of defects that would occur and so forth, and changes and twisting and turning. And it's always hard to maintain a beautiful, straight, symmetric nose and maintain function at the same time. So by adding some newer procedures, we've been able to do that.
Wow.
I never thought about it. So a lot of people, they'll get nose jobs and they have those cute little turned up noses. They're not done properly, and sometimes they have problems breathing, right?
Right. You know, a lot of people come in and they say they just want a smaller nose. They'll bring in pictures from a magazine. They'll say, I want this nose or something. And it's not that the nose is like a piece of clay. And we can just kind of mold it however we want it. It's really a functioning organ, and we need to maintain breathing as well as function all the time.
You betcha. So this new technique that you've come up with, how does it address those problems?
Well, the biggest problem with, or the most common way of doing nose surgery is a reduction rhinoplasty, where most people want to have their nose smaller, a little bit more refined. And whenever we take pieces out, or cartilage out or bone out, that tends to cause things to collapse and weaken the nose. So instead, what we've done is instead of removing all the cartilage, we're reshaping it now. And we're reshaping it, making it a little bit smaller, but maintaining function. And as it scars down, as it heals, sometimes it can twist or turn, or some unevenness can show up. And that's when we started adding this new substance called Dermamatrix, which can really help smooth out and add better symmetry to the nose.
Is that sheets of collagen, or where does sheets of collagen come into play?
Yes, it's a sheet of collagen. It's called Dermamatrix. And it's been used in the medical field for a long time for things like hernia repairs, skin grafting. And knowing that we've had this problem with scarring and unevenness, and then seeing this being used in other fields, I thought, wow, I wonder if this would work for rhinoplasty surgery. And sure enough, we've been using it for the last few years, and it's worked very well.
It's worked very well, and it's certainly worked well for Craig. And welcome to the show. And
thanks for having me.
And tell us a little bit about yourself and what brought you to Dr. Raval.
Sure. Well, a few years ago, I founded my own clothing line by the name of Craig Mueller, and it's a collection of dressy suits for ladies that ladies can wear to special occasions or cocktail events. And for the past couple of years, we've been doing business with Neiman Marcus, primarily in their mail order division, which is online and catalog. Being one of the new designers they're promoting, I found myself going to a lot of functions and having my picture taken in magazines and newspapers. And one of the things that I kept looking at those pictures, it just bothered me, was my nose. I just thought it was a little too wide. I didn't like my profile. I thought it was a little too long. So a couple years ago, I embarked on the journey of researching rhinoplasty procedures and came across Dr. Raval's name in the magazine Bloom for Colorado and also the Beauty magazine. So that enticed me to go online. And really, he has one of the widest ranges of before and after shots of rhinoplasty procedures that any other physician has. And he has a wide range of people from different ethnic backgrounds, and in every case, his results look natural and beautiful which really illustrated to me that he has not only an aesthetic, but a true talent for...
Now you're looking hot for the fashion world, baby.
We'll see.
Dr. Raval, we have before and after pictures here, as well as another patient. Walk us through, please.
So this is Craig, and his biggest concern was just the curvature of his profile. And one thing he didn't mention was that he's only 2 weeks out from his surgery. So
oh my gosh.
It really doesn't bruise as much as you think. Wow. He does have a little bit of swelling, but you really get back to functioning very soon. And then his after picture just shows that he's just a much straighter, smoother profile, with really no lumps, bumps, or asymmetries. Very symmetric, very straight.
Wow.
And very natural.
Good job,
was really kind of the point. Another example, this one was also actually a revision surgery. A patient had surgery before. And you can see there's some things with the cartilage that have scarred poorly. Things are, if you look at the bottom of the nose, it hangs down a little too far. We did a revision surgery with her and really just kind of smoothed out her profile. And created a much more natural look.
I can't believe, Craig, you're only 2 weeks out from surgery. And
only 2 weeks.
Is there much, it doesn't sound like there's a whole lot of discomfort or anything.
Not really. The best way I can describe it was just really congestion, the discomfort of not being able to really breathe for a couple days. But really, that was it.
And then we have one more. We had another, this was actually a revision as well. Again, there were some asymmetries as well, and then we were able to straighten her out with the dermamatrix and some collagen grafting.
That's great.
I think the key word that I keep hearing over and over is natural looking.
Correct.
I mean, obviously there are patients that come to you because they're not happy with the results of other physicians.
Right. If someone comes to me and they say, or if someone mentions, well, you have a really great nose job, then I've done something wrong. Because we want it to look so natural that most people can't figure out what's going on. They'll just say, they'll see someone who's had my surgery and they'll say, you look good, did you change your hair, you know, have you been working out or something, but they really won't be able to put their finger on because the nose looks so natural. And that's the goal.
And this is something for somebody who hasn't had any prior procedure or somebody that wants to have it redone again?
Correct. If someone has developed some asymmetries from a previous surgery, we can fix it with the dermamatrix as well.
Doc, great seeing you. Craig, you look fabulous, buddy.
Thank you.
All right, the techniques are all designed with your comfort and results in mind. Dr. Jeffrey Raval can show you how the Denver nose job, as he calls it, will give you a more youthful look, and you'll also appreciate his professionalism and courteous staff. For a consultation at Rocky Mountain Laser Aesthetics, call Dr. Raval, 303-381-3223, or visit ravalmd.com.
When you mention that you saw Dr. Raval on Colorado and Company, you'll receive a free consultation for any facial plastic surgery procedure. It's a $150 value. And if you call before September 7th and schedule a surgical consultation with Dr. Raval, they'll waive the $150 consult fee again. Their number again is 303-381-3223. That's 303-381-3223. You can also learn much more online at ravalmd.com.